Leading a startup team, whether you're delivering a sugar rush, stocking coffee, or getting a regular delivery of snacks, Office Depot has solutions that fit every startup culture, from getting those first business cards and stationery to ordering fleece pullovers with your new logo. To learn how Office Depot and the California Technology Council have partnered to bring you savings on all of these startup essentials and more, go to californiatechnology.org/member benefits. I'm Daniel Levine, and this is the Bio Report. Matt State is known for his work trying to understand the biology underlying psychiatric illness, but as the chairman of the University of California, San Francisco's Department of Psychiatry, part of his job has been to help address the city's homelessness crisis. Homelessness is a complex issue, but the role mental health plays in the problem is often overlooked. With about 10,000 people who are homeless in San Francisco, more than a third of these people have a psychiatric or substance abuse problem. We spoke to State about the connection between homelessness and mental health issues, UCSF's efforts in this area, and how it fits with the mission of a leading public institution. Matt, thanks for joining us.
Oh, thanks for having me.
We're going to talk about homelessness, your efforts to address San Francisco's homelessness problem, and how you find yourself involved in this issue as the head of UCSF's Department of Psychiatry. Though this is a problem by no means confined to the San Francisco Bay Area, I think anyone who has been to San Francisco or the surrounding areas would be struck by how visible and pronounced the crisis is here. For people outside the area, can you describe the extent of the problem?
Sure, I'd be happy to. So there are a lot of questions there, but I'll start by describing the problem. So San Francisco currently has approximately 10,000 individuals who are on the streets, who are homeless, and a larger population that have insecure housing. A good proportion of that population suffers from other challenges, and that gets to the question of how I'm involved, but a significant proportion suffer from serious mental illness, from chronic substance dependence problems, exposure to violence and trauma, so it is not just a numbers game, but the challenges that population faces in San Francisco is quite apparent in the way that people experience those that are homeless in the city. I would just add that I agree with you that the focus in the city right now is certainly on that population and the importance of our being able to provide not only appropriate housing but appropriate care for them. But I also say, that at this moment, California and the nation really is struggling with the acute homelessness that's occurred as a consequence of the fires, and just want to make sure we don't forget that in the conversation today.
Fair enough. I think there's a tendency to think of the issue as an economic one, although it's a lot more complex than that. To what extent do mental health and addiction issues intersect with other issues in the realm of homelessness?
So the first thing to say is that in San Francisco, there's no question that one of the things that's contributing to this problem is the lack of affordable and available housing, including supportive housing. So there is no question that to some degree this is driven by that problem, and that's an economic problem. And there are folks who will say, the most most effective way to combat homelessness is to invest in homes. And that strategy, the idea of having housing for people, is absolutely essential. There's no question that is necessary ultimately to solve this problem. But the rest of what you asked is also tremendously important because, as I just mentioned, there are a very large percentage of people who find themselves homeless, and particularly find themselves among the most chronically homeless, suffer from these other kinds of issues. And it's where my role as chairman of the Department of Psychiatry really comes in at UCSF, where we have a real commitment to serving the public around the issues of trauma, severe psychiatric illness, and substance abuse. While investing in housing is absolutely essential, it is also essential for us to be able to effectively address the care that many of the individuals who find themselves chronically homeless need.
To what extent has the issue of access to mental health services been tied to the growing problem of homelessness?
I think there is no doubt that limitations in the availability of services in San Francisco is exacerbating the problem with homelessness. I think nationally you can see that the trends that have taken place with the reduction in mental health services initially, long ago with the opening up of and then elimination of things like state hospitals, but even more recently with kind of chronic reductions in a community mental health system, that whenever there's a decrease in those kinds of services, then the problem of homelessness is exacerbated. And so, what is remarkable in San Francisco is that overall it's a tremendously generous city right now with regard to the kind of investment that's made in mental health. But there still is a challenge. There still are challenges around providing enough beds, providing enough slots in substance abuse programs, providing enough opportunities for wraparound services for those with mental illness. So there's no question that we can do better, and there's also no question that if we were doing better, then both sort of the overall problem and the public's experience of the problem of homelessness would improve. I'd just add that we can talk about sort of the tendency for nihilism to set in around these problems, but I would say that it's a particularly exciting moment of opportunity right now because of the longstanding commitment of our governor-elect and the new mayor in San Francisco, who understand not only the importance of housing, but of the connection between these other chronic social problems and chronic homelessness.
How did you become involved in this issue, and what role is UCSF playing in addressing the problem of homelessness and delivering care to this population?
UCSF is an academic medical center, but that has a broad reach in San Francisco and in the region. So when I accepted the job of psychiatry, chair of psychiatry at UCSF about 5 years ago, one of the things that drew me here was the sort of broader mission that UCSF not only runs from a medical standpoint, UCSF Health, but also provides medical care through the county system. Our docs are the medical staff, the entire medical staff at San Francisco General, which is the safety net hospital and really ground zero for the homeless population with regard to the mental health care, substance abuse, and physical health care. And we also run a variety of quite large community-based programs that serve this population. We do this in partnership with the city, who's often providing the lion's share of funding here, but we have multiple programs. For instance, we run something called Citywide Focus, which is one of the largest providers of wraparound services. That means comprehensive service for folks with serious mental illness. We run something called the Alliance Health Project, which provides services particularly for at-risk individuals in the LGBTQ community, which is dramatically overrepresented, sadly, within the homeless population. We run something called the Trauma Recovery Center, which is really a model program, not only for San Francisco, but for the state on taking care of individuals who've been exposed to violence. And again, those populations populations, particularly women exposed to violence, end up being overrepresented within the homeless population. And then on top of that, we also run the psychiatric services at the San Francisco VA hospital and a number of outlying clinics throughout the Northern California region. So when you take a look at all of that, or I ended up as chair on day one, being responsible for mental health care to these individuals. And honestly, it's one of the reasons that I decided to move from the East Coast to UCSF because it is a kind of a remarkable institution in its commitment not only to world-class science and outstanding patient care, but really to the public mission. Here within the university, that part of the reason that I'm able to do what I'm doing right now is because of the work of other folks here, and a couple in particular. So we, Margot Kushel has been really a national leader in thinking about the role of housing in homelessness, and our chancellor Sam Hawgood has been intensely interested, honestly, along with our CEO, Mark Larrett, and our Dean, Talmadge King, in really trying to understand what is the most positive role that...
As a leading research institution, are you doing anything to better understand this problem from a psychiatric point of view?
Yeah, absolutely. And I think not only are we trying to, in anything that we do at UCSF, as you point out, as an academic medical institution, we both kind of take it as a driving part of the mission, not only to provide care and to make sure that it's outstanding, but also to continually push to advance knowledge. And a variety of the programs that I've talked to you about are actively involved in taking a look at how we can improve services, find programs that are more effective and more efficient in providing care. One of the things I didn't mention, which is incredibly important with regard to kind of how the homeless problem plays out practically in the city, is that, as I said, we staff ZSFG, the Zuckerberg San Francisco General, and we also staff a psychiatric emergency service there, PES, which is the only receiving facility for people who've been put on psychiatric holds in the city. And there as well, we're always trying to take a look at how we can more effectively and more efficiently take care of people in acute crisis in order, if we can, to prevent prolonged hospitalizations, prevent the downstream consequences of severe psychiatric illness. So it is part and parcel of what we do, not only to provide the care, but to try to advance our understanding of how to do that better. I'd also say that one of the things that I'm extremely interested in as well. So you asked how I got into this, and one of the reasons that it's I think some people see it as a bit unusual is that my background is as a molecular geneticist. My professional life has been dedicated to trying to understand the biological basis of psychiatric illness, and some people see that as sort of antithetical or orthogonal to everything that we've been talking about. I don't, and one of the reasons that I've been interested in trying to understand at a deep level what is going on with psychiatric illnesses is that it is really a path for us to do far better in treating these conditions. And it's also a path, I think, to begin to erase stigma. That much of what drives our stigma and judgment and marginalization of the mentally ill and substance use disorder population is really the misunderstanding and the mystery. And when you take a look at the history of what's happened with things like cancer, where no one would talk about it 50 years ago, scientific information, the ability to understand that and treat it effectively, transformed the way that people experience cancer, the way that people viewed cancer from the outside, and the discussion about that. And I really feel strongly that part of what we can do at UCSF, in addition to providing services and figuring out how to do that better, is to contribute to a deep understanding of things like schizophrenia, autism, bipolar disorder, borderline personality disorder, what drives some people to be highly vulnerable to substance dependence while others are not. And I think if we can make that kind of contribution, it will also be a contribution to addressing the homeless problem.
And are those issues causes, or are they symptoms? Do people have these problems and then end up becoming homeless, or do they become homeless and this creates these problems?
So, by and large, by the way, it's a great question. For the most serious mental illnesses, by and large, the interaction is with the mental illness either driving or exacerbating problems with homelessness. There's really no evidence that even a major stressor like homelessness will lead someone who's not highly vulnerable for something like schizophrenia or autism or severe mood disorder to develop that. Now, at the same time, there's no question that stress exacerbates psychiatric illness dramatically and can contribute to, latent risk then emerging more kind of overtly. So it may not, it's not as simple as simply saying, well, it's always psychiatric illness driving homelessness, but as a general proposition, at least for the kinds of disorders that I've described for you, our understanding is that these are largely disorders that are driven by intrinsic factors with an input from the environment and not caused solely by, say, the trauma of homelessness. Now, that it gets a little bit more complicated around the issues of something like post-traumatic stress disorder, and there are particular psychiatric illnesses that are directly tied, the diagnosis is actually tied to a stressor, but for the things I described for you, there's no evidence that homelessness per se causes schizophrenia or causes autism or causes severe bipolar disorder.
UCSF is a public university, and I think people there have always felt part of their mission is public education. The public can often lack compassion in viewing people who are homeless. They can be concerned about the problem being an eyesore or creating a safety concern rather than considering the welfare of these people. Is there a role for the university to play in framing the problem for the public?
One of the reasons that I was thankful for you inviting me to come on your program today was precisely that we feel that it's important for the university and the Department of Psychiatry not just to be in our own world sort of addressing these problems, but to play a larger role in our helping to educate the community and to interact with the community around these issues. One of the things I'd say is that, over the last several years, after coming into this job, as I said about 5 years ago, I've been particularly interested, and we have a very large number of faculty who are really actively engaged, not only in trying to convey information to the public, but to help develop more kind of coherent approaches within the department to do that. One of the things that we've been doing most recently is that we've engaged in a partnership with the city and with Tipping Point Philanthropy that is explicitly aimed at bringing together a whole variety of constituencies, including the university, to address this problem. Some of that is to come up with an agreed upon plan and program, particularly around this intersection of homelessness, mental illness, and substance use disorders. But a good portion of this as well is to try to make sure that we're bringing communities together to do education and to do outreach and to begin to mitigate some of the problems that you described, which, by the way, are profoundly important for individuals with psychiatric illness, not just the homeless. That the kinds of adjectives that you described around homelessness are things that, sadly, people with mental illness across the socioeconomic spectrum continue to suffer. It is a population that's highly marginalized. It's a population that is criminalized. The largest provider of mental health services in the United States is the criminal justice system. There is no other area of medicine where that would be even remotely tolerated. It would be seen as completely shameful, and that still, unfortunately, is the situation with regard to mental illness. And as you can imagine, when you think about what that means, that the intersection then between the marginalization, serious illness, the need for services, a vulnerable population that can be criminalized, then how you can imagine that none of that is good for making sure that someone is securely housed. And so we really have a cycle of problems, a universe of problems that need to be dealt with simultaneously in order to address the underlying issues in the homeless population in San Francisco.
At the start of this discussion, I think you mentioned there were 10,000 people in San Francisco who are homeless. While that's a significant number, it's nevertheless finite. This is a finite problem. Why have cities had such a hard time addressing this issue?
Yeah. So I love that you said that for a couple reasons. The first is that I think it's really important that the point that you just made is underscored, that yes, it is a very large problem. There's no question, but it is also a finite problem. And when I wake up in the morning and I risk being down about the sort of intractability and the complexity of the problem, the fact that it is a finite problem is something that I think is really important for us all to remember. That it is something that can be addressed. And actually, I mean, the scale of the problem here, just in terms of sheer numbers, compared even to something like Los Angeles County, it is a finite problem. It's not an easy problem. Clearly, it's not. As I said, our governor-elect, when he was mayor here, was highly committed to this problem, and I think probably would be the first to say that his administration didn't make the kind of progress in ending homelessness that they would have loved to. So it's not easy, but I do think it's tractable. So then the next question, or the next part of this, which is why, if it's a finite problem with only 10,000 people or something like that, that's not a hard number. There's something called the SPOT survey, which goes out annually to take a look at the number of homeless in the city, and the numbers there are somewhere in the neighborhood of about 8,000. I think people in the field feel like that's a reasonable ballpark, but it's the numbers more likely higher, and then particularly when you start taking a look at those who are insecurely housed, the numbers even higher than that. But it's still, regardless, is finite. So why aren't we doing better? We're a generous city, a city that generally cares about things like mental illness and providing services to people, et cetera, and yet we still have this problem. Honestly, it's something that these are multi-determined problems. They take coordinated efforts. They take strong leadership, and they take a sustained commitment. And the fact is, I said a few moments ago that I'm particularly optimistic at this moment, and I am because we have a governor-elect and we have a mayor who are sophisticated about the problem, understand that it is a problem for the city, but that it's also a regional problem, understand the importance of mental illness, substance use disorders, and taking care of the pathway to homelessness with things like adverse childhood experiences and those kinds of things. They understand the problem, and I think with active leadership, when you take a look at the handful of cities that have done very well with regard to homelessness, one of the things that distinguishes them is active leadership, bringing communities together, getting rid of kind of parochial interest and siloed interests, working in a coordinated way to bring together, say, people interested in housing with people committed to mental health, serious illness in vulnerable populations, substance use, those kinds of things. And I think we are at a moment now where there's this intersection of public interest among philanthropy in San Francisco, among the business community, certainly among the academic community in UCSF, with really committed leadership, and it gives me hope that we can and should be one of the counterexamples, so that a year from now or 2 years from now, your question won't be why aren't we solving this, but the question will be why isn't the model that San Francisco has used successfully is not being more broadly applied across the nation.
Is there anything you've learned through these efforts that you think could be applied elsewhere to better address the problem in other cities?
So, I mean, I think, we need to take care of what we're doing here first. I think that there is a lot of potential know-how here. Certainly right now, we would not I don't think anyone in San Francisco would hold itself up as a model for what other cities should be doing in homelessness. But I think that there is a path forward for us to begin to address problems in a creative way that I think, we should definitely aspire to that, becoming a model. I think that, our ability to really take a comprehensive approach to this is something that is beginning to form, I think, organically and can help reinforce important examples from other places around the United States to show what a good path forward is. One of the things I have to say is I often, when I talk about the homeless problem, and it's one of the things, I'm dealing with a faculty that has been engaged in this for a very long time, and I have faculty at ZSFG who, were on Ward 86 in the very first days of the AIDS crisis. And what happened during that time, when I hear about UCSF's role, when I hear about what the city was able to do, with the same kind of energy around a big crisis for the city, that people were able to come together in San Francisco in a remarkable way and take on, an enormous challenge. And so I think that there's a lot that we can take from that experience and to use as a model for what we need to do to attack the crisis of homelessness. And I can tell you that a lot of what we did in San Francisco became a model for the nation around taking care of folks with HIV and AIDS, and there's no reason that people shouldn't be looking to San Francisco around this crisis in the same way.
Matt State, chair of UCSF's Department of Psychiatry. Matt, thanks so much for your time today.
Thank you so much.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send an email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.